And welcome back to the Morning Blend, where we're transforming your health with Columbia St. Mary's, part of Ascension. Skin cancer is the most common form of cancer in the United States. In fact, it's estimated that 8,500 people are diagnosed with skin cancer every day.
That's a ton. It's also important to know that it's also one of the most preventable and treatable forms of cancer.
That's right.
Joining us now to discuss more about the symptoms and ways to stay healthy is Dr. Heather Wells from Madison Medical Affiliates, which is a partner with Columbia St. Mary's. Hello, doctor.
Yeah, good to have you here.
Thanks for inviting me.
Let's start with the basics. What is skin cancer? There are three main types we're looking for.
Right, so the most common form of skin cancer is basal cell carcinoma. That's the majority of the skin cancers we see. There's also squamous cell, which is kind of a mid-range as far as its risks and what it can do to patients. And then there's melanoma, which is the one that is, if undetected, can be the most deadly.
Are pretty much all of them caused by overexposure from the sun?
That is one major risk factor, and ultraviolet radiation causes DNA damage, which then leads to skin cancers.
Okay, so what are some of the risk factors then? Clearly then, if we're in the sun, we all know wearing sunscreen, making sure we're protected, sometimes wearing UVA-B clothing, things like that. So what are the risk factors people can be aware of?
So one is repetitive chronic sun exposure, bad blistering sunburns in your lifetime is a risk factor. And then the color of your skin, lighter skinned individuals are going to have a higher risk. Light colored hair, light colored eyes, those are risk factors. Having many moles on your skin, whether they be normal moles or there is a variant of what we call atypical moles, those are risk factors. Family history of skin cancer, having a lot of freckling is also a risk factor.
Did you just describe me? Fair skin, light eyes, lots of burns.
Right.
But I think, you know, that's the thing is a lot of people, you know, if you are somebody who you burn easily in the sun, you don't tan, you just get pink. That's what I say a lot. If someone does get tan though, do they still have to worry if you've got more, you know, melanin in your skin? Yeah,
so I mean, melanin is there to protect our skin and try to block some of that ultraviolet from coming in and damaging the skin, but it's not 100%. So even people who have really, really dark skin have risk of sun exposure and can get sunburns, and also because they don't think about putting sunscreen on as often either.
Right, because you figure you've got that base already. So now let me ask you, we were talking about this beforehand a little bit. When I was 18, literally I'd put baby oil all over myself. And I do remember a couple of times where I had blistering sunburns. That was in the past, you know, is that still a... Am I in danger, I guess?
Yeah, so if you've had a history of multiple bad sunburns, so those are those intermittent bad sun exposures, that does put you at risk. And the ones that it puts you at risk for are basal cell carcinoma and melanoma.
Okay. What about indoor tanning beds?
Ooh. So indoor tanning, yes. So ultraviolet in general, no matter which way you get it, whether from natural or from indoor artificial, is going to increase your risk of skin cancer. The problem with indoor tanning is people tend to do it more frequently. Also, if you started at a younger age, it increases your risk of a melanoma by a significant amount.
Well, and this is going to be one of our true false. So we've got these true false questions for you. You can just hold up, and some of them may be a little bit of both, right? So you can share that as well and then give us the answer. So true or false? I burn the first time I'm out in the sun, but as my skin darkens, I'm not getting a burn. So I don't feel like I'm burning. True or false?
So it's somewhat true that you are developing melanin in your skin, which then helps protect you, so maybe you aren't going to get a burn, but tan skin is damaged skin.
So this is a true false.
Right, this one's kind of both, right.
Okay, we kind of touched on the sunburns as a kid once. You know, that's very true. It can affect you later in life.
Right.
Okay, and then we touched on tanning beds too. You know, I want to start my tan to avoid burns the rest of the summer. Is that a good way to avoid burns?
Well,
true or false?
It's not that you just burn your skin. I mean, so it's, again, it's true that you are, you know, increasing your melanin, which helps kind of prevent a sunburn, but you're still getting UV damage through that. I mean, none of us are going to get dark enough that we're going to be able to get to a high enough SPF. I mean, we recommend an SPF 30. So skin isn't going to get, the melanin production's not going to get you to 30 to protect you.
And how often do you have to reapply? Because a lot of people, you know, they'll use a 70, there's 50, there's 30, there's 15.
There's 100.
What are the rules here?
So I usually recommend for daily sunscreen use, you should do at least a 30. So SPF 30 on the exposed areas. So face, neck, chest, hands, whatever is exposed. then if you're going to be out for long periods of time, or if you're going on a tropical vacation or things like that, then I would do an SPF 50 or higher. When I get to those higher numbers, you're not seeing a huge incremental change, but it also has to do with how much you put on. Most of us don't put enough sunscreen on.
Right.
Right.
Yeah, I remember them showing like a shot glass full.
Right, 1 ounce.
And that's a lot more than most of us use.
Right.
There's an easy acronym that a lot of people can use to identify moles that are potentially questionable, that you should see a dermatologist for. And it's an ABCDE.
Right.
What are these? What do these stand for?
So A is for asymmetry. So one half looks different than the other half, no matter which way that you cut it.
Yeah. Okay. B.
B is irregular borders. So border irregularity.
All right.
And C is color variation. So you would see blues and blacks and browns and whites and reds. That in one lesion, that would be concerning.
D.
D is larger than 6 millimeters in diameter. That's a softer criteria.
Okay. E.
E is evolution or evolving. So if you're seeing a mole that's changing over time, that's concerning.
Okay. Real quick, we're out of time, but fake tanning, the lotions, the creams, okay for your skin?
I mean, if you wanted to get color periodically and you needed to, you want to have a little bit of a different color to your skin, I guess you could use some of that. I'm not a big advocate for those because, again, it's putting chemicals on your skin that maybe aren't necessary.
Yeah,
right.
It is.
It's important to see your dermatologist once a year, get screened, do a full body test monthly as well.
Yes, and you should do monthly full body skin checks. We are offering a free skin cancer screening on Wednesday, May 24th at the Ozaukee Hospital for Columbia St. Mary's, and you can call and make an appointment. Also, looking at the spotskincancer.org website allows you to find information about dermatologists that are offering skin cancer screenings and what to look for in skin cancers. That's perfect. And Dr. Wells and more are at Madison Medical Affiliates, Columbia-stmarys.org. The phone number to call for an appointment there is 414-298-7100. May is Skin Cancer Awareness Month, so make sure you do your checks at home. Good to have you here.
Yeah, thank you very much. Lots of great
information.
information.